So today's conversation is coming at you guys because on Sunday, 9/22/24, we are speaking to electrologists with Electrology Education Coalition, which is our other business, where we do continued education for hair removal experts or allied practices that are trying to get themselves heavily invested in understanding their patients' problems within like accessing care and understanding larger problems like hirsutism and hypertrichosis and understanding PCOS. And so this conversation is specifically because we're in PCOS Awareness Month. I have PCOS. I'm an electrologist and laser technician, and I feel that it's really important for professionals that would be encountering hirsute cases to talk about it with our whole chest, okay? Because it has not been talked about and it's been real taboo for a long time, and that's just like, it's not cutting it anymore. So this Sunday, 9 a.m. Pacific Standard Time, you're free to go over to electrologycoalition.com. It'll be up here in a second, where we're gonna talk about the fact that hirsutism, hypertrichosis, PCOS, there's something that we gotta talk bigger about, and it's understanding it. So first part of this conversation is like, what's the difference between those two that I keep mentioning? So hirsutism, right? This is excessive hair growth on those assigned female at birth, okay? That is typically in male pattern growth patterns. So like full beard growth, usually you might have excess growth on like your chest, your abdomen, your back, inner thighs. It's in those patterns, okay? And when that happens, there is usually an onset of when it arrives to the body. Usually that's typically during puberty where we see it trickle in, and then it gets stronger over the years depending on how much we stimulate it. The big thing about this is there are comorbidities with PCOS that sometimes when we see hirsutism, if a patient has that like non-managed medical pathway for their PCOS, we kind of chase the hair growth for a long time, because if they have the propensity for hair growth and they have androgen excess, which is causing the excess hair growth, then they're gonna struggle harder to get to their goals. Doesn't mean they're not gonna get there, but that struggle is gonna come with a lot more uphill battle with like excess, like everything, just the weight of the world on your back. So with those comorbidities, it is really important to understand that some of them are very dangerous if unchecked, and sometimes that hair is the signal for the rest of the world to say, hey, we're off balance, okay? Now, hypertrichosis is excessive body hair that is not necessarily related to androgen excess, okay? It can occur everywhere on the body, and it's usually generalized, covering like large areas, okay? And it can be localized as well. Now, between these two, hypertrichosis is usually a genetic factor. It's like medications like minoxidil will sometimes help with that one, or it might have systemic conditions in there as well, and it's usually not linked to the androgen excess because of those things. And it usually has like a what's the word I'm looking for, like an at-birth diagnosis. That word's not coming to me. Watch, at the end of this, I'll have it all of a sudden. So when that happens, we say, okay, what's your family's history of hair? Now let's talk about this, because families for a long time didn't talk about excess hair on those members assigned female at birth because it was taboo, right? So often people don't even realize that the women in their family previous to them really struggled with hair because they kept it a secret, because the world said, nope, those people presenting female should not have hair. Mind you, we're all mammals, we got hair. It's just a matter of how much we're gonna see it. Now, with hirsutism usually comes on because of the androgen excess, and we have got to talk about how to manage that, because with PCOS, Hashimoto's, some thyroid disorders, some medications that may cause an onset of something, it usually means that it's impacting a lot of different things in the body, and we have to talk to your doctor about it. Because I'm okay with removing hair on you for a very long time, okay? Totally fine with it. Love having you on my table. Love the meetings. I love the being able to talk to people. Here for it. But I know, as a patient with PCOS, that there are things that I've had to do to greatly change how I navigate my health, okay? Because they caused bigger issues behind the scenes of my PCOS, and my hirsutism was the identifier early on when my hormones hit, right? So when I came into puberty, my body was like, hey, we don't know what to do here, and it went crazy, okay? So as you're looking through these things, whether you're a provider or a patient, it is really important, if you have patients presenting a lot of the same comorbidities within PCOS, and this is where we start researching the heck out of this. And if you wonder why I keep using the word comorbidity, it means that there's a lot of things going on within that disorder that activate other systems of the body. That's like the best layman's term, okay? So with that, sometimes those are risky, and we have to find out how to balance that. So you can have better quality of life, right? Your patients can have better quality of life. Now, as an electrologist and laser technician, it is outside of my scope to then talk on those items and diagnose you. I can talk about it from a patient perspective and help guide you. And as a professional, I can help guide you towards using the right words in your doctor's appointment to advocate for yourself. But the only way they know about it is if you advocate. So it is really important to really get to know this. If you are a patient, I wouldn't say join this Sunday, but I would say that it's worth downloading, purchasing and downloading after the fact so you can use that terminology to help you, okay? But, okay, when we think about that, we've got to use it as like a tool to understand that like your technician is also trying to learn about these things and your doctor is. So it is a matter of the words that we need to help research. If you're a provider, please join us. It really helps to have a lot of providers there. Electrologycoalition.com, it's gonna go across my head, right? And purchase the lecture, join us live on Sunday. It is really important to start talking about this and stop making it taboo. We are mammals. Mammals have hair, okay? We are human mammals, okay? And so we have a little bit of judgment that comes at us with that hair. But we can do something about it. And we can get to know what's happening behind the scenes and give our patients better quality of life, better words to fight for their health, better words to be able to talk to their doctors and make their world a better place, hair-free, carefree, and feeling healthy. So I hope this is a little ignite your soul to come join us for one of our lectures. I look forward to seeing you guys 9 a.m. Pacific Standard Time on Sunday, which is September 22nd, 2024, if you watch this another year, okay? But it is really important to talk about this. We need to start the conversations, and as electrologists and laser technicians, guess what? We make some pretty fine advocates when it comes to talking about hirsutism, when it comes to talking about hypertrichosis, because we studied the heck out of a hair, right? And so it's time for us to help providers that don't study this get in the know so they understand that we are also watching and can help them understand how to battle this, how to conquer, and just have our patients feel better in the skin that they're in, the body that they're in, every dang day of the life, okay? I'll see you guys soon. Peace, love, and hair removal. Have a great day. Bye.